Thank you, Jose.
So could you tell me about the most recent developments in the new cases? Like yesterday, Lugo has the biggest jump since the beginning of the virus.
Well, yesterday, let's see, yesterday, March 26th was the biggest one-day jump, but we were not really concerned about that because we knew it was coming because we're just going to have more test results right now. So, for some comparison, we had 60 tests positive so far in Jefferson County with 2 deaths, unfortunately. Both of the deaths were from older people with underlying chronic conditions, so the type of warnings we've been talking about. For some comparison around that, Metro New Orleans is about the same size as Louisville. I looked this morning, and New Orleans has 993 cases and 46 dead. So it looks like they might become kind of the next hotspot. And a lot of that happened because they had all the big Mardi Gras festivities, and people came together. And it just takes a few what they call the super spreaders with the virus for this virus just to pass from people to people. And that's why we're emphasizing the need for social distancing and people to stay away from each other and not let the virus pass.
We have received a lot of questions and comments from people that are concerned with their places of work. And I guess we can imagine that there's probably hundreds of places where groups of people work together. And people are afraid to complain and also worry about their own health working in those environments.
Well, we got to remember we have a health crisis and we got a financial crisis, but the health crisis is what comes first. Right now, because of the governor's orders and my orders here locally, only essential businesses should be in operation. And there's a definition of that on the Kentucky website, kycovid19.ky.gov. If people suspect that they are working right now and there's unsafe conditions, you can dial 311 and report that place, and then we'll send a health inspector out or somebody else to check out what's going on. So we've gotten quite a few calls in that regard. So your safety comes first. And if any business is operating right now thinking they're going to get away with this, they're not going to, right? You've got to be taking care of your employees' health. That's number one. Number two is, people are saying, I got to keep working. I got to get a check. And I understand that this is causing a lot of financial anxiety. Literally within the last 30 minutes here on Friday at 2:10 p.m., the House passed the supplemental bill number 3. So that's the $2 trillion relief bill. And part of that is the extra unemployment. So basically, you've got 4 months worth of pay coming your way now through unemployment, which is good. That's going to take a lot of pressure off of people. Now we've got to get to where we're at from today until that check comes. But if you are filing taxes before, the government has your direct deposit. If you've done direct deposit, that's the way you're going to get your money the quickest. Also part of that relief bill are direct checks or direct deposits. They're going to be coming to all taxpayers with a full $1,200 per taxpayer payment if you make $75,000 or less. So if you and your wife or spouse have that condition, that's 2 checks for $1,200 and then $500 per child. So that's meant to stabilize the household on top of the unemployment insurance. So it's really important that people understand that that's coming so that they can plan accordingly.
Small businesses, especially immigrant small businesses they never navigated the system before. It's like have no idea where to go. Maybe do you have any ideas on, or maybe plans about helping immigrant-owned businesses that are totally unaware of what's the first step?
Right. So if we can hope, and there's going to be some good things that come out of this, right? I mean, it's tough right now, but one of them, I think, will be our foreign-born communities, our immigrant communities, understanding how to navigate through local government, state government, federal government, because keeping small businesses alive and healthy is extraordinarily important. Small business is the backbone of our country. So you can see what's available for small businesses by going to louisvilleky.gov/Louisville Forward. Then our Office for Globalization is run by Sabine Nassim. She's working on translating documents into 10 plus different languages or so. and she's with the office for our Louisville Forward. So she's with economic development. So that would be the best way I'd push people right now. Then also understand in this $2 trillion relief package that was signed today, there's a massive section on that for small business relief, for loans and for grants. So our job at Louisville Forward is going to make sure that people can walk you through what those issues are. And Jose, maybe if you could help us to make sure at louisvilleky.gov/Louisville Forward, we want to put some examples in there, right? If you're this kind of business, here's what you should be doing. Here's how you could apply. Here's the kind of assistance that you need. So, and for our foreign-born community, you are our brothers and sisters. We want more of you in our community. You're responsible for a lot of our population growth, our entrepreneurship, and the vitality of our city. So we want to know how we can help so that Louisville can come out of this and say, you know what, they're the most immigrant-friendly city in the country.
Are you concerned that some cities are taking a lot of measures and some others not, as well as counties and states? Bill Gates said last night on CNN that this process is not going to work if some do one thing and some others do a different thing.
What's supposed to happen with a crisis like this is there's supposed to be a nationally managed response so that everybody in the country is approaching it the same way. That has not happened during this current administration. And that's why you're seeing mayors and governors are being kind of the on the ground decision makers as to what's best for their cities and their states, which I think that's great. But here's the challenge with that. You can take like the Commonwealth of Kentucky. Governor Andy Beshear, I think, has done a really good job on this. And we've been working multiple times a day. We're talking back and forth and coordinating our efforts. And then we've had our own efforts here as well. When the states on the West Coast started seeing the virus, that's when we started acting here as well. So we're hoping that our early action is going to prevent this big spike in our healthcare system from being overrun that you're seeing in New York and New Orleans. You saw it in Seattle, Italy, China, et cetera. So the states that we're around right here, Ohio, Indiana, Illinois, Kentucky, we've all basically got a stay-at-home order. Tennessee is not there yet. So this virus doesn't care where you live. And so that's why I'm trying to emphasize the importance of a national response so that we can all follow the same kind of guidelines to minimize the spread of the virus. That's what this is all about, right? Trying to minimize the spread so fewer people get sick, fewer people die, and that our healthcare system has enough capacity. So if you are sick, when you go to the hospital, you can get care. The worst case is what you're seeing like in Italy, where there's just not enough care, not enough doctors, not enough nurses. So they're making decisions. Let's say they look at Greg Fischer, 62-year-old guy, and they look at Jose Neodonis and say, good looking, healthy, how old are you? Probably 42 years old, something like that.
I look like that, but I'm older.
And they say, Jose is younger, he's healthier, we're going to give him health care, not to Greg. Too bad, Greg. That's not where we want to get in the country, okay, or in our city. So that's what all this is about, is just making sure everybody stays healthy, everybody can get health care. And I would add our doctors and nurses. And these other places, you're seeing doctors and nurses getting the virus at alarming rates too. So then there's nobody to provide health care. And so that's when we decide, people ask, when are we going to go back to normal? That decision will be driven by the virus, right? When we see our cases coming down, when we see we have adequate capacity in our hospitals, and we see that our public health department has capacity to test, to identify, to trace the victims of this, so that we can respond in a robust and successful way. So to set a date on when all this is going to be over is out of step with science, out of step with data. China saw was they had very loose restrictions at the beginning because the way their society runs, they weren't talking about it publicly. So people just went about their lives in a normal way. And when that was going on, the virus just passed and passed and passed. Hopefully that's not what we've done here in our city. So we'll have the big spike that they had. So that's what led to China, this massive lockdown, much more severe than what we've got going on here. And then after 2 months, they released that back. So as a matter of fact, Dr. Steve Jones at the University of Louisville has a colleague right in the middle of the hotspot there in China who sent him a note last Friday and said, I just want to give you guys hope. Here we are 2 months after the lockdown, and all of my lab is working again. We're all coming back to work. So there is a tomorrow if we take the discipline today, the personal responsibility we've been talking about, right? Social distancing. If you're sick, stay home. Don't touch people. Don't shake people. If you're close enough to breathe, sneeze, or cough on somebody, you're too close. Okay. So we all got to do our part. Stay home as best you can. You can go outside and get some exercise and fresh air. But again, be social distance at least 6 feet, 3 weeks from today.
Okay. About the census, I read yesterday an article in California in Spanish about how the response from the Latino community has been way slower than they were expecting because of the virus. What have you seen so far? Have you been able to see anything like that in Louisville with the immigrant community? And are you prepared to maybe push a stronger effort in the short future?
Yeah, well, that's one with everybody staying home right now. There's plenty of time to do the census, but I have not seen the exact data from Louisville yet on what's been completed. I did see some Kentucky data. We're a little bit behind the national response rate, which I think is about 25% so far. But the date for people going out and knocking on doors, if you have not responded online or via phone or sent your census in by mail, that's been pushed back. And originally, I think was going to start in the middle of May or so. So I'm not sure how long that's been pushed back. Jose, you can find that online, so that there's more time to do the census. So this is something through the United States Conference of Mayors that we've talked to the census folks about, and they've agreed with that. And if it needs to be extended even further, we're going to advocate for that, because it is super important that we all get counted, because the more count that we have here means the more federal dollars come to us for our healthcare, for our classrooms, for food programs, in the best of times. So you can think about the census we did 10 years ago. Some of that is going to result in directing the money that we're going to be getting for the relief programs that we're getting. So super critical. The census is taken. It is totally confidential by law. The data cannot be looked at. I believe it's for like 70 years. So there's never been a problem with that. And before this pandemic, obviously, we were concerned about our immigrant communities participating in the census, because some of them were fearful for that information could be used to come and look for undocumenteds or whatever it might be. And that was concern was here beforehand, much less with the pandemic. So I just want to really emphasize that the information is confidential. All of the kind of activities the government was doing around ICE raids and all that, that's all been suspended. The focus right now is just getting through this pandemic, this COVID-19.
All right. Well, thank you. And I don't know if you have anything else to add. Uh,
Yeah, I mean, it's a tough time, because you got to face up to the brutal reality of what's going on with this pandemic that none of us have ever lived through before. But we all got to change our behavior. It's like we got the biggest football, the biggest soccer match of the year. It's World Cup time, baby. And so it's us, the human race against Team COVID-19, right? And so everybody's got to say, what's my role on the team? And everybody's role starts with defeating the virus. And the best way to do that is say, okay, I got to change my lifestyle a little bit. I've got to isolate, I got to social distance, I got to stay home if I'm sick, all these things we've been talking about. But if you have not changed your life because of COVID-19, you are not helping the team. Okay. And we need everybody to help the team right now. So that's one thing. The second is, even in times like this that are really difficult, we've seen amazing acts of generosity and compassion come out. So people should know there's a lot of good things that are going on right now in terms of people helping each other. And while we might be socially distant, we're still socially connected. We launched an emergency relief fund called Louisville COVID-19 Relief Fund. I wanted to announce it with $2.5 million. I announced it with $3.6 million, and now it's more than $5.6 million. So that's for people that have been directly financially hit by the COVID-19. You can go to louisvilleky.gov, and you'll see in the top left-hand part of the website. You can click on that and get more information. And then liftuplu.com, liftuplu.com, or at liftuplu is community morale building, so we're creating community songs, having community cooking lessons, and all kinds of fun things. And we want your ideas on how to be creative and connect each other that way as well. So it's a challenge we're all going through. We all know we will get through it. We'll get through it by relying on each other, and there'll be brighter days ahead. So I appreciate everybody helping out.
Thank you, Mayo.
Jose, always a pleasure.